I believe Mr. Magoko, my good old friend, has seen this transition. I don't know how many of us were there at this age when our TVs probably had what we have taken over. And it has happened that as our TVs became smaller, we have transformed to where they were. I do not know what led us there, but hopefully someday we will be able to see if we can both be at the same level. And what we're talking about is the good thing is this was done earlier for me, so we are able to see that globally 14 million people die each year from non-communicable diseases, and these are people between 30 and 70. Probably there are those of us who are 20 in this forum and they're thinking, I'm 20, so I have all the time. It's only 10 years if you're 20. And the question is, what will you have by the time you're 20? You're 30 if you're 20 today. And unfortunately enough, the probability of dying from any of the major non-communicable diseases between the age of 30 and 70 is between 10 and 60. That is in the globe. And that is happening in the low and the middle income countries. So where are we as a country? We had a STEP survey, which is a risk factor survey for non-communicable diseases last year. And it was found that 27% of deaths suffered by Kenyans are as a result of non-communicable diseases. And this is equivalent to 370,000 people per year. And what does this mean? That we have a reduction in the productivity, we are curtailing our economic growth, and the poorer can only get into chronic poverty. And unfortunately, if we are living in Kenya, which is where I believe we all are living, the probability of dying young from a non-communicable disease is 18%. We can do something about non-communicable diseases. And the good thing about non-communicable diseases is that we have what we call modifiable risk factors. That means there's a lot I can do about them. And we have non-modifiable risk factors. I like saying this. If I'm 80 today, I don't think I'll be 20 tomorrow. So that is non-modifiable. But if I weigh 110 today, I can weigh 70 in a couple of months, which all goes around my choices. The one thing about non-communicable diseases is that they're fashion conditions. How are they fashion? If I remember, back in the days, there was a cigarette called Roaster, for those who probably have an idea. And because I'm a lady, I do not want Danor to find me holding a roaster. So what will I do? I'll get a sportsman. Technology is a good thing. I can always use the e-cigarette. Isn't that fashion? And now this is where I always like asking this question. Mimi ni daktari, isn't it? Or now today I'm in the presence of honorable members. If the person seated next to you is an honorable member, and they come to your home riding on a bicycle, what will you tell them? What is the likely reaction? Ameishiwa. Smart up, isn't it? But now, this is what I like asking. Have you thought about it? If she or he has managed to ride a bicycle to your house, don't you think they're fitter? Don't you think they're healthier? Don't you think they're saving our environment? Don't you think they're even saving more? So unfortunately, in Kenya, it has been shown only 6% of the people take fruits and vegetables. It's unfortunate because I've listened to a number of children, and what do they say when they're told to eat vegetables? Especially the children we're bringing up. They say it's rabbit food, isn't it? Have we told them why rabbit food is healthy? We probably need to let them know. This is what is happening. As time goes, we have talked about HIV, we have talked about malaria, we have talked about TB, and they're all going down. The good thing about these conditions is that they're treatable. If you have malaria today, how many days does it take you to get back to normal health? 3 days, isn't it? What if you have diabetes? It's going to be lifetime. So those are some of the things that we really, really need to think about. And this has happened across the globe. As time went, the non-communicable diseases back in the days only accounted for a very small percentage of diseases. That has changed over time. This was earlier said that half of our admissions in our hospitals are because of non-communicable diseases. And unfortunately, half of hospital-related or reported deaths. What I ask is, do we know the number of deaths attributed to non-communicable diseases where people do not die in hospitals? And what could it be? Again, our society has a way of determining our health status. And it's unfortunate that, it's both fortunate and unfortunate that we are a developing country. And we are moving really fast. But as we develop, a lot of things are happening. And one of the things we need to take note is developed countries can afford for their population proper protection from non-communicable diseases. They've had these things for a very long time. In the low and the middle income countries where we belong, we are in a catch-22 situation. We're dealing with malaria, TB, and HIV. And now here we have the non-communicable diseases. So we are dealing with a double burden of disease. And in higher income countries, they're able to access services and products that protect them from the greatest risk factors. While, as I was listening earlier, we're still grappling with what I would call small issues, like drugs. Why are we where we are now? We have had rapid, unplanned urbanization. I would call it rapid urbanization. But had we planned for it, really? For a very long time, we've had a little understanding of the risk that comes with chronic conditions like heart disease, lack of access to healthcare, and what is the cost of treatment? This is where I ask, how much does it cost to treat malaria? 40 shillings. Is that the much it costs? 40 shillings. Okay. How much does it cost to get a month's supply for somebody who's living with diabetes or hypertension? 3,000 at least. Okay. So why are non-communicable diseases important? In the World Health Assembly, where issues health are discussed, we began at HIV. Non-communicable diseases is the second condition to be discussed at that level. That is how important it is. So, we all know these people, and this is what they have to say. That if unchecked, non-communicable diseases have the potential of crippling growing economies like ours, and success will only come by focusing resources on people, not their illnesses, and on health, not on disease. That was the UN Secretary General, Ban Ki-moon himself. And Margaret Chan, the director of WHO, said that non-communicable diseases are a disaster in slow motion, and they are diseases that break the bank. And we may not necessarily need to get there. So in a Kenyan perspective, where are we today? In Kenya, the health expenditure remains less than 5% of our gross domestic, of our GDP. And our health services are more curative than preventive. And the person who was here a few minutes before I came, she talked about visiting health facilities. And I asked our leaders, what can we do at the community level to prevent conditions and provide support for the people with the conditions so that we have a better outcome? Back in 1989, we had the Abuja Declaration, which proposed that governments should allocate at least 15% of their budget to health. Where are we at? And we're not there. That's the truth is we're not there. And for those of us who sit at the health committees, what can we do about this? General ailments at the household level. If somebody has a communicable disease as opposed to non-communicable diseases, they're likely to spend 13.6% of their income on their condition. However, if they have a non-communicable disease, they're likely to spend twice that much. And it's unfortunate that 51% of households with non-communicable diseases will have a catastrophic expenditure. And more to this, 48, almost half of households with non-communicable diseases are likely to end in an impoverished state, meaning that non-communicable diseases only or have the potential to keep pushing us to poverty. Now this is where I ask, we need to develop, right? We need to grow. How possible is it for us to grow in poverty? Do we hear advertisements about this every so often? TB na tiba, malaria, HIV. This is what we hear on our media, on our media every so often, isn't it? Do we hear anything about if you make 10,000 steps every day, you keep healthy? What happens? The youth. And again, if you did not plant a tree 20 years ago, when is the next best time? Now. At least in the next 20 years, you'll say, I own a tree. Okay. And globally, we have targets. This is what we call 25 by 2025. 2025 is 8 years away. 2016 is over. And we have a goal of 25% reduction in premature mortality from non-communicable diseases by 2025. Do you think this is achievable? It's achievable. So that's why focusing on the youth, we're not wasting our resources. True? The youth are the greatest population of our country as it is. So if we made sure that all the youth do not end up with a non-communicable disease, what does that mean? We have more resources to grow, we have more investments to think about, and less to spend on disease. right? But on the other end, we need to spend more on prevention. But again, what is it? What is cheaper? What is cheaper? So this far, we have the Global Action Plan 2013-2020 for the prevention and control of non-communicable diseases. And soon after this, and in the same context, we have the Kenya Health Policy. We have a Kenyan National Strategy for the prevention and control of non-communicable diseases. It has a vision of a nation free of avoidable burden of non-communicable diseases, because it is possible. And it has its guiding principles and the pillars. And again, non-communicable diseases is not something that the Ministry of Health can do alone, because what we eat is affected by agriculture, isn't it? Where we walk is affected by transport, infrastructure, and security. What we know, education has a bit of that in it, isn't it? And non-communicable diseases are not just about the individual. Earlier, as we began this session, somebody asked, and I will ask this again, is there anybody in this room who does not know or has not heard about somebody who is affected by a non-communicable disease? This is nice. Okay. Who among us has been invited to raise funds for malaria treatment? For malaria treatment. And who among us has been involved or invited to a forum to raise funds because of a non-communicable disease? That is the only time the hands get to go up. So what does that say? There's a possibility that we're not able to financially handle what comes with non-communicable diseases. And other than dealing with it, we need to deal with it from a life course approach, meaning the earlier it begins, the better, but not the non-communicable. The earlier the prevention begins, the better. But we still have options. And this is where I get to ask, if we have a running tap in the house, do we keep wiping the floor or do we replace the tap? So why do we want to keep wiping the floor as far as the non-communicable diseases are concerned? Can we replace the taps? We have various levels of prevention. We have the primary level of prevention when we do not have the disease. We have the secondary level, and we have a tertiary level. But there was one very critical point, the primordial prevention. We have the youth and the adolescents who become the young mothers, isn't it? If these people have the information when they're still young, are they likely to have a better outcome even if they have the babies early? Are they? Okay. So, you'll probably ask what we have been doing. We have several policies that are actually addressing NCDs. We have the National Strategy for the Prevention and Control of Non-communicable Diseases. We have National Diabetes for the National Diabetes Strategic Plan, which is under revision now. And I'm sure Mr. Magoko was one of those people, together with Jane, were part of that document. We have the diet and physical activity policies. Here we have a National Action Plan on Physical Activity, and we have a National Guidelines on Healthy Diets. We are actually looking into a trans fat regulation, and I will call upon the honorable members in this house today to assist us at this level. We have a few gaps here, and I believe that is what Mr. Nyaga and Patrick have been looking into, so that we can be able to move on to the next level. Like you know, we are probably one of the countries in the world that has ratified the tobacco laws very well this far. We are also doing relatively well when it comes to cancer. We have the Cancer Act, we have the Cancer Strategy. And in a nutshell, non-communicable diseases are actually about all of us. And if all said and done, I will echo the words of this gentleman. If we miss the first button, we will not succeed in buttoning up our coats. Thank you.